Welcome back to our special after the show edition of The Doctors, where we recently got very candid with our audience members when the show was over. Before the break, you met a woman who was very concerned about a mysterious growth on the roof of her mouth. So we called in our friend and colleaague, Dr. Bill Dorfman, to check it out.
So let's take a look.
So does everybody see that?
Is that how
Wow. Let's pull that up on our big screen for everyone. Y'all see that?
Oh, wow.
All right.
We'll get it in focus here.
You can't miss that.
So the first thing we have to determine is whether it's soft or hard. Okay? If it's soft, it could be cancer, it could be an infection, it could be a lot of things. So let me just feel this real quickly.
If it's hard, it could be too.
Yeah.
And
That's really hard. Okay. I have a scope here. It's called a Bell scope. And what we can do is shine that on the bump. What it does is any abnormal tissue that's cancerous or precancerous will show up. Okay. But I think what you have is called a palatal torus. And what a palatal torus is, it's an overgrowth of bone. It's totally benign. It usually happens right after puberty. And for some bizarre reason, it happens in about 20% of the population, and mainly in Asians. Really? And we don't know why.
More often in women, and you can get them
on
your jawbone too. So I think what Dr. Dorfman is saying, it's just an anatomic variation, that it's an overgrowth of bone. The thing is, though, Bill, that she's
the blister. Well, let me explain that. So here's what happens. When you have this hard bone and you have soft skin over it, if you eat something, like let's say you eat an apple, and that's really hard, if that apple abrades it, you're going to cut the skin. It's basically what we call Bony Extostosis. It's just benign bone growth. Mainly we see it here, open wide. A lot of times people have it down here, and when they're wearing dentures, it's really hard to wear because it's down here. Sometimes that torus can fill your whole palate. You're lucky, yours doesn't, but I've actually seen it where it fills the whole palate. So as long as it doesn't continue to grow, you can leave it alone. If it's a kind of thing where it's causing you problems a lot, you can actually have it removed. And basically what we do is we make a little tiny incision, we grind it down, and then we suture you back up. It's about a 45-minute procedure. But let's rule out the big C, cancer, and make sure it's not, okay? So I have this little scope called the Bell scope. And basically what we're going to do, you close your eyes, open real wide, we shine this light on here, and then we look through the scope, and it looks normal and healthy. What happens is when we look through here, if there's any cancerous tissue, it's going to show up black because that tissue absorbs the light. Okay. Yours isn't.
This
it's
analyzes the lining, the mucosa in the oral cavity, right?
And the nice thing here is that you're saying this is a benign growth, but one of the cool things that someone like Dr. Dorfman can do is if you're noticing a new growth in your mouth, you know, you want to get it looked at sooner rather than later, because if it's not benign, you want it to be addressed sooner rather than later. So we're happy that this is benign, and it sounds like
Dr. Dorfman, I just have to ask, how accurate is that? Should she still go get a biopsy? Should she still?
You know what? She definitely doesn't need a biopsy.
Okay.
This will pick up actually precancerous growth. It's definitely, I know exactly what it is. Here's the general rule of thumb for anything in your mouth, any oral lesion. If it's not gone in 2 weeks, you get a biopsy. This is not a lesion, this is a bony growth. But if you have a sore, I actually had a patient come in with a sore behind her back molar, and I told her that I wanted her to come in 2 weeks. She went and saw her physician. He looked at it and said, it's fine. She came back 6 months later, it was still there. Squamous cell carcinoma.
Ouch.
Had she waited 2 or 3 more months, she wouldn't be here today.
Wow.
So don't wait. If
But
you
this
have
is
something,
benign.
this is not. But if you have something and it's not gone in 2 weeks, get a biopsy.
Bill, thank you.
Awesome.
Thank you all.
Thank you, doctor.